Well, every Friday morning, we welcome a community leader to our airwaves, and today we are welcoming the president and CEO of Saratoga Hospital, Mr. Angelo Calbone. Welcome. How are you?
Very good. Good to be here.
Saratoga Hospital in the center of all the things we're talking about, coronavirus, COVID-19. First, what's going on?
We have some of the best people I've ever had the pleasure to work with on this issue, literally 7 days a week. Our internal planning starts early in the morning and goes through evening. And how we're trying to position ourselves is prepare for the worst and frankly hope for the best. But all of the internal energy has been focused toward two primary goals. First, to protect our staff, because if we don't protect our staff, we can't take care of our community. Right. And the second, right up there, is to continue to provide the care the community needs. So those are our overarching priorities and goals that drive everything that we're doing.
Who can go to the hospital, a visitation policy, things like that? What's going on?
We are moving toward a no visitation rule. This is to protect our staff, create a safe environment, and to minimize contact. There'll be some exceptions to that for compassion reasons, end of life, OB, and the like. But by and large, people coming to the hospital will not be able to have visitors join them.
The governor has been very vocal about why we're doing all of this holding back of how many people are in one place. And right at the hospital, we can't afford to have an unknown, factor in this spread. So it's sort of, some of the terms like softening the curve, if you will, having things so we don't get to this real bad place.
Right, exactly. There's a belief that a great many people will ultimately be exposed to this virus and maybe catch it. We're all working very hard to make sure that doesn't happen all at once, because hospital resources may not be sufficient if entire communities are infected in a very close way. So flattening that curve is slowing the spread, social distancing, doing things like we're doing with our visitation policy to slow down the spread. The more we slow it, the closer we will ultimately be to a treatment or a potential vaccine.
Right.
So it pays off in multiple different ways.
What are some of the things that we're doing with the interaction with the hospital, calling first, those type of things? What would you advise?
We're still providing most levels of care at the hospital. We're just being very careful. We're protecting our staff and doing things like I mentioned about visitation. Our advice, and frankly, the world's advice right now, is if you're experiencing flu-like symptoms or if you have concerns that you may have been exposed to the virus, don't simply go to an urgent care center or the ER or show up at your doctor's office. Call your doctor, explain what you're experiencing. The advice may be, stay at home, let's watch this, or the advice may be, let's get you tested. Call first, begin that evaluation process. We have a number of our physicians that are doing telephonic physician visits and video chat physician visits, and they appear to be working very well.
Good.
So we have the ability to help people, look in on them, give them good advice and direction, and still keep that social distancing.
Very good.
So the advice is call your doctor. If you don't have a doctor, call the county department of health. And ask for some advice.
What else can we do to help as a community?
Being aware of the things we're doing at the institution and why we're doing it is very helpful. So we've been working hard to get the message out through our social media channels, our website, fielding a lot of calls. So knowledge is very important right now. We're also very challenged around supplies. Supplies are important. We've had local businesses actually donate very valuable components to us. Face goggles, N95 masks, basic dust masks. Those are actually very useful to us. So we've shared that across the entire community.
Wow.
That if hardware stores are sitting on supplies of those kinds of things, if businesses find that they don't need it, we'd love to have it.
They can help,
We'll borrow it, we'll buy it, we'll take a donation.
Right.
And we have actually had a number of folks step up, and we very much appreciate that.
That's fantastic. Mr. Calbone, You mentioned the social media or the website, and that is way people can find out more. There's probably even how they can participate in donating,
Exactly.
whatever. What is the website?
SaratogaHospital.org.
Wow, that's simple enough. And
Simple enough. We are updating that. I can't even say on a daily basis.
Right.
Sometimes it's an hourly basis with information and reinforcing the message. That really is the best portal into how to know what's going on at the hospital. We know people are being inundated with information right now.
Yeah.
Unfortunately, some of that information is inaccurate. Go to reliable sources. Go to the State Department of Health, the County Department of Health, our website, and interface with your personal physician provider.
Well, thank you. And thank you to everybody at Saratoga Hospital, everybody involved, because we're all in this together.
We are. Thank
Yeah.
you. Thank
And
you.
Again, SaratogaHospital.org, and we thank Angelo Calbone, the president and CEO of Saratoga Hospital, for joining us this morning. Thank you so much.